Welcome to an in-depth look at tumor lysis syndrome, a critical emergency that can occur during cancer treatment. When cancer cells are destroyed rapidly, either by chemotherapy, radiation, or oral anti-cancer pills, they release their internal contents into the bloodstream. This sudden release can overwhelm the body's ability to process and eliminate these substances, leading to a cascade of metabolic disturbances. In this video, we'll explore what happens during tumor lysis, why it's dangerous, and how it's managed in clinical settings. Let's begin by understanding the basics of how cancer therapy can trigger this syndrome. After a cancer diagnosis, patients are often started on treatments such as chemotherapy, radiation, or other adjuvant therapies. These treatments are designed to kill cancer cells quickly and efficiently. However, as these cells die, a process known as lysis begins. This is a crucial point in therapy as the breakdown of cancer cells can have unintended consequences. The rapid destruction of a large number of cells releases their contents into the bloodstream, setting the stage for tumor lysis syndrome. Understanding this process is key to recognizing the risks involved in aggressive cancer therapy. It's not just intravenous chemotherapy or radiation that can cause tumor lysis. Oral anti-cancer pills, which are increasingly used in modern oncology, also have the potential to trigger this process. These medications are designed to target and kill cancer cells, but when taken by mouth, they can still lead to a rapid breakdown of tumor cells. This means that even patients on oral therapies are at risk for tumor lysis syndrome, highlighting the importance of monitoring and early intervention regardless of the treatment route. Cell lysis refers to the breakdown or destruction of cells, releasing their internal components into the surrounding environment. In the context of cancer therapy, this means that as tumor cells die, they spill substances like potassium, phosphate, and nucleic acids into the bloodstream. This sudden influx can overwhelm the body's normal metabolic processes, leading to dangerous imbalances. The process of cell lysis is central to understanding why tumor lysis syndrome can develop so quickly and why it requires immediate medical attention. When tumor cells undergo lysis, several key substances are released into the bloodstream. These include potassium, phosphate, uric acid, and nucleic acids. Each of these substances can have significant effects on the body's organs and metabolic balance. For example, high levels of potassium can affect the heart, while excess uric acid can damage the kidneys. The release of these substances is what makes tumor lysis syndrome a medical emergency, as they can quickly lead to life-threatening complications if not managed promptly. One of the most serious consequences of tumor lysis syndrome is kidney damage. As uric acid and phosphate levels rise in the blood, they can form crystals that block the kidney's filtering system. This can lead to acute kidney injury or even kidney failure if not treated quickly. Patients may experience symptoms such as reduced urine output, swelling, or flank pain. Early recognition and intervention are critical to prevent permanent kidney damage in patients at risk for tumor lysis syndrome. Patients experiencing tumor lysis syndrome may develop symptoms such as weakness and confusion. These symptoms are often the result of electrolyte imbalances, particularly high potassium or low calcium levels. The nervous system is highly sensitive to these changes, and even small shifts can lead to significant neurological symptoms. Recognizing these early warning signs is essential for timely intervention and can help prevent more severe complications, such as seizures or loss of consciousness. Another major concern in tumor lysis syndrome is the risk of heart problems. Elevated potassium levels, known as hyperkalemia, can disrupt the normal electrical activity of the heart, leading to dangerous arrhythmias or even sudden cardiac death. Patients may experience palpitations, chest pain, or irregular heartbeats. Continuous cardiac monitoring is often required for patients at high risk, and immediate treatment is necessary if arrhythmias are detected. Tumor lysis syndrome is characterized by a constellation of metabolic abnormalities. These include hyperuricemia, high uric acid, hyperkalemia, high potassium, hyperphosphatemia, high phosphate, and hypocalcemia, low calcium. Each of these imbalances can have serious effects on different organ systems, and together they create a complex clinical picture that requires careful management. Understanding these metabolic changes is crucial for healthcare providers treating patients with cancer. Among the substances released during cell lysis, phosphorus and potassium are particularly important. High levels of phosphorus can lead to secondary hypocalcemia, while elevated potassium can cause cardiac arrhythmias. Managing these electrolyte disturbances is a top priority in patients with tumor lysis syndrome. Treatments may include medications to bind phosphate or lower potassium, as well as dietary restrictions and intravenous fluids. Patients with tumor lysis syndrome often require hospitalization for close monitoring and intravenous therapy. Hydration is a cornerstone of treatment, as it helps flush out excess substances from the bloodstream and supports kidney function. In severe cases, patients may need intensive care, including dialysis or other advanced interventions. The goal is to stabilize the patient and prevent complications while continuing necessary cancer therapy. Intravenous hydration is one of the most effective ways to prevent and treat tumor lysis syndrome. By increasing urine output, hydration helps the kidneys eliminate excess uric acid, phosphate, and potassium. This simple but powerful intervention can make a significant difference in patient outcomes. Hydration is often started before cancer therapy begins and continued throughout treatment for high-risk patients. Clinical symptoms of tumor lysis syndrome can vary, but common signs include muscle cramps, weakness, confusion, nausea, vomiting, and decreased urine output. More severe symptoms may include seizures, cardiac arrhythmias, and even sudden cardiac death. Recognizing these symptoms early is vital for prompt intervention and can be life-saving for patients undergoing cancer therapy. Diagnosis of tumor lysis syndrome requires at least one laboratory abnormality such as elevated uric acid, potassium, or phosphate, combined with a clinical symptom. In some cases, two or more laboratory criteria may be present. Regular blood tests are essential for monitoring at-risk patients, allowing for early detection and intervention before severe complications develop. Preventing tumor lysis syndrome is a top priority in oncology. Prophylactic measures include aggressive hydration, medications to lower uric acid, and close monitoring of electrolytes. Patients at high risk may receive these interventions before starting cancer therapy. The goal is to minimize the risk of metabolic complications and ensure safe, effective treatment for cancer. Pathophysiology of tumor lysis syndrome involves the rapid breakdown of tumor cells, leading to the release of intracellular ions and nucleic acids. These substances are normally processed and eliminated by the kidneys, but in large amounts they can overwhelm the body's capacity. This results in hyperuricemia, hyperkalemia, hyperphosphatemia, and hypocalcemia, each contributing to the clinical picture of TLS. Tumor cells lyse, they release not only electrolytes but also nucleic acids such as DNA and RNA. These are broken down into purines, which are then converted into uric acid. High levels of uric acid can crystallize in the kidneys, leading to obstruction and acute kidney injury. This process underscores the importance of monitoring uric acid levels and using medications to prevent uric acid buildup in a at-risk patient. Hyperuricemia, or high uric acid levels, is a hallmark of tumor lysis syndrome. As nucleic acids are broken down, uric acid accumulates in the blood. If not managed, this can lead to the formation of crystals in the kidneys, causing pain, hematuria, and even kidney failure. Medications such as allopurinol and rasburicase are used to lower uric acid levels and protect kidney function. Hyperkalemia, or elevated potassium levels, is another dangerous complication of tumor lysis syndrome. Potassium is released from dying cells and can quickly accumulate in the blood. High potassium levels disrupt the heart's electrical system, leading to arrhythmias and potentially sudden cardiac death. Immediate treatment is required to lower potassium and stabilize the heart. Hyperphosphatemia, or high phosphate levels, occurs when phosphate is released from lysed tumor cells. This can lead to secondary hypocalcemia, as phosphate binds to calcium in the blood. Symptoms may include muscle cramps, tetany, and seizures. Managing phosphate levels is essential to prevent these complications and maintain metabolic balance. Hypocalcemia, or low calcium levels, is a direct result of hyperphosphatemia in tumor lysis syndrome. As phosphate levels rise, calcium binds to it and is removed from circulation. This can cause symptoms such as tingling, muscle spasms, tetany, and even cardiac dysrhythmias. Calcium supplementation may be necessary in severe cases to restore normal levels and prevent complications. Electrolyte imbalances in tumor lysis syndrome can manifest as a range of symptoms, from mild to severe. Patients may experience tingling, muscle cramps, weakness, confusion, and in severe cases, seizures or cardiac arrest. These symptoms are a direct result of the body's inability to maintain normal electrolyte levels after rapid tumor cell breakdown. Cardiac dysrhythmias are a life-threatening complication of tumor lysis syndrome, primarily due to hyperkalemia and hypocalcemia. The heart relies on precise electrolyte balances to maintain its rhythm, and disturbances can lead to irregular heartbeats, palpitations, or even sudden cardiac death. Continuous cardiac monitoring is essential for patients at risk, and immediate intervention is required if arrhythmias are detected. Acute kidney injury is a serious risk in tumor lysis syndrome, resulting from the accumulation of uric acid and phosphate crystals in the kidneys. This can cause symptoms such as reduced urine output, swelling, and flank pain. Early intervention with hydration and medications can help prevent permanent kidney damage and support recovery. Tetany and seizures are neurological complications that can occur in tumor lysis syndrome, often due to hypocalcemia. Tetany is characterized by involuntary muscle contractions and spasms, while seizures can result from severe electrolyte disturbances. Prompt recognition and treatment of these symptoms are essential to prevent further complications. Altered mental status, including confusion, agitation, or even loss of consciousness, can be a sign of severe tumor lysis syndrome. These changes are often due to electrolyte imbalances affecting the brain. Immediate medical evaluation is necessary to identify and correct the underlying cause, ensuring patient safety. Diagnosing tumor lysis syndrome involves a combination of clinical symptoms and laboratory findings. At least one laboratory criterion such as elevated uric acid, potassium, or phosphate, plus a clinical symptom is required for diagnosis. In some cases, two or more laboratory abnormalities may be present. Early diagnosis allows for prompt treatment and better outcomes. Preventing tumor lysis syndrome is a key focus in oncology care. Strategies include identifying high-risk patients, starting hydration before therapy, and using medications to lower uric acid and manage electrolytes. Close monitoring during and after cancer treatment helps catch early signs of TLS and allows for rapid intervention. Managing potassium levels is critical in tumor lysis syndrome. Dietary restrictions, potassium binders, and medications such as sodium polystyrene sulfonate or Pathophysiology may be used. In severe cases, intravenous insulin and glucose can help shift potassium into cells, while calcium gluconate may be given to stabilize the heart. Cardiac monitoring is essential throughout treatment. In cases where kidney function is severely compromised, renal replacement therapy such as dialysis may be necessary. This intervention helps remove excess potassium, phosphate, and uric acid from the blood, supporting the body's recovery. Early initiation of dialysis can be life-saving in patients with severe tumor lysis syndrome. Managing phosphate levels is another important aspect of tumor lysis syndrome care. Oral phosphate binders can help reduce absorption from the gut, while dietary restrictions may also be recommended. Maintaining normal phosphate levels helps prevent hypokalcemia and its associated complications. In cases of severe hypokalcemia, calcium supplementation may be necessary. Intravenous calcium gluconate is often used to quickly restore normal levels and prevent complications such as tetany or cardiac dysrhythmias. Careful monitoring is required to avoid overcorrection and maintain metabolic balance. Loop diuretics may be used to increase urine output and help eliminate excess potassium and phosphate. These medications support kidney function and can be an important part of the management strategy for tumor lysis syndrome, especially in patients with adequate kidney function. Glucose and insulin therapy is used to rapidly lower potassium levels in the blood. Insulin drives potassium into cells, while glucose prevents hypoglycemia. This combination is often used in emergency situations to stabilize patients with severe hyperkalemia. Allopurinol and rasburicase are medications used to lower uric acid levels in patients at risk for tumor lysis syndrome. Allopurinol prevents the formation of uric acid, while rasburicase breaks down existing uric acid into a more easily excreted form. These drugs are essential for protecting kidney function during cancer therapy. Continuous cardiac monitoring is essential for patients with tumor lysis syndrome, especially those with electrolyte imbalances. Monitoring allows for early detection of arrhythmias and rapid intervention if needed. This is a standard part of care in high-risk patients and can be life-saving. Educating patients and their families about the risks and symptoms of tumor lysis syndrome is crucial. Awareness helps ensure that symptoms are reported early and that patients adhere to preventive measures such as hydration and medication schedules. Empowering patients is a key part of comprehensive cancer care. Managing tumor lysis syndrome requires a multidisciplinary team, including oncologists, nephrologists, nurses, and pharmacists. Collaboration ensures that all aspects of care are addressed, from prevention and monitoring to treatment and patient education. This team approach improves outcomes and supports patient safety. Ongoing monitoring is essential for patients at risk of tumor lysis syndrome, both during and after cancer therapy. Regular blood tests, vital sign checks, and symptom assessments help catch early signs of complications and allow for timely intervention. This vigilance is key to preventing severe outcomes. In summary, tumor lysis syndrome is a potentially life-threatening complication of cancer therapy. Early recognition, prevention, and aggressive management are essential to protect patients from metabolic and organ complications. With a team approach and vigilant monitoring, most patients can be safely treated and continue their cancer therapy. Let's consider a case example. A patient with newly diagnosed leukemia starts chemotherapy and develops weakness, confusion, and decreased urine output. Blood tests reveal high potassium and uric acid. Rapid intervention with hydration, medications, and monitoring prevents kidney failure and stabilizes the patient. This case highlights the importance of early detection and aggressive management in tumor lysis syndrome. Current research and clinical guidelines emphasize the importance of risk assessment, prevention, and early intervention in tumor lysis syndrome. Studies continue to refine best practices for identifying high-risk patients and optimizing treatment protocols. Staying up to date with the latest evidence ensures the best possible outcomes for patients. For those interested in learning more, several key references provide in-depth information on tumor lysis syndrome. These include recent articles in nephrology and oncology journals, as well as clinical guidelines from major medical organizations. Accessing these resources can help healthcare providers stay informed and deliver the highest standard of care. Thank you for joining us in this comprehensive overview of tumor lysis syndrome. Understanding this emergency is vital for anyone involved in cancer care, from healthcare professionals to patients and families. With knowledge, vigilance, and teamwork, we can ensure the best outcomes for those at risk. Stay informed, stay prepared, and continue to support each other in the fight against cancer. As we conclude, remember that tumor lysis syndrome is a preventable and treatable complication of cancer therapy. Early recognition, proactive management, and patient education are the pillars of effective care. By working together and staying informed, we can make a real difference in the lives of patients facing this challenge. Thank you for your attention and dedication to improving cancer care.